Welcome to The Debate. Last year, the global health system essentially lost track of tens of millions of human beings. They died, and we have absolutely zero official record of exactly why.
Which is just, it's a staggering reality to confront.
Right. It's the equivalent of running a massive global hospital where, half the patient charts just vanish into thin air.
Yeah, and it completely changes how you view our supposedly data-driven modern world.
It really does. And as part of the Problem-Based Learning Lab, our PBL lab segment here in Project Plain Talk, we are diving deep into the World Health Organization's World Health Statistics 2026 report. This document is essentially, our planetary pulse check.
A very weak pulse.
Exactly. We are now standing less than 5 years away from the 2030 Sustainable Development Goals, the SDGs. And that pulse we are measuring is incredibly weak. We're basically looking at a world caught between remarkable technological progress and terrifying systemic fragility.
Yeah. And the central question jumping out of this material is pretty profound. I mean, the stalling of the 2030 SDGs is undeniable across the board, right?
Oh, absolutely.
But we are looking at two very different interpretations of why that is actually happening. Like, does this stagnation represent a failure of execution and financing, meaning we just need to double down on our targeted medicalized interventions? Or, and this is where I land, does this report expose fundamental structural flaws in our entire global health paradigm?
See, when I look at these numbers, I see a blueprint for global health that is actually incredibly sound. Targeted international coordination works brilliantly when it is fully funded and rigorously tracked.
But is it working now?
Well, the progress we are losing right now isn't because the medical model is flawed, it's because we are facing an acute financial and data crisis. I mean, we are starving a proven system of capital and visibility.
I look at those exact same numbers and I just see a massive red flag for the way we conceptualize health in the first place.
Really? A red flag for the whole model?
Yeah, absolutely. The stagnation we're seeing, especially in universal coverage and environmental health, it proves that our reactive, disease-focused model is fundamentally inadequate for modern challenges. We are obsessively treating symptoms while the underlying ecosystem just collapses.
Let's ground this in the actual data from the report, because the victories of the targeted approach are undeniable. Look at HIV. We have achieved a 40% decline in global HIV infections since 2010.
Sure, which is great.
It's massive, and we've seen dramatic drops in tuberculosis, particularly in the African region. This is what happens when focused, international coordination zeroes in on specific pathogens. You identify the biological mechanism of a disease, you engineer a pharmaceutical intervention, and you scale it.
I mean, I don't deny the historical success of those specific campaigns.
But that is the core of the system. The stalling we are seeing isn't a failure of that mechanism. It's a resource issue, plain and simple.
Is it, though?
Yes. The WHO projects that official development assistance for health is going to drop by 30% to 40% in 2025 compared to 2023. You simply cannot maintain a high-performance vehicle if you siphon the gas tank dry.
Right, but that assumes the vehicle is driving in the right direction. Let's look at the Universal Health Coverage Index, the UHC. This is supposed to be the moral core of the SDGs, right?
Right, measuring access without financial ruin.
Exactly. It measures whether people can access essential health services without enduring financial hardship. And between 2015 and 2023, that index crept from just 68 to 71.
It's a stagnation, certainly.
It's a near total freeze. I mean, it's moving at a third of the pace we saw between 2000 and 2015. And we have to unpack the human cost behind that number. An estimated 1.6 billion people either live in poverty or are being actively pushed into poverty because of out-of-pocket healthcare expenses.
Right, the costs are huge.
Healthcare has somehow become a paradoxical luxury in an era of unprecedented scientific innovation.
But again, isn't that an argument for more funding, not a different paradigm?
No, it's an argument that the paradigm itself generates unsustainable costs. While we celebrate isolated metrics, suppressing a virus here, delivering a vaccine there, we totally ignore the invisible architecture of human health.
What do you mean by invisible architecture?
I mean that 99% of humanity is breathing unhealthy air. That directly contributed to 6.6 million deaths in 2021 alone. This proves our model merely reacts to sickness. We wait for the lungs to fail, and then we sell the patient an inhaler, rather than proactively building a healthy society.
I hear the frustration there, I really do. But the history of public health shows that technical medical interventions are the most reliable, measurable paths to actually saving a life in real time.
But they're not enough anymore.
They are foundational, though. The victories against HIV or the accelerating childhood vaccination rates against HPV, these are not happy accidents. They are the result of treating health challenges as solvable engineering problems. When you shift the focus entirely to vast environmental and structural realities, you risk losing the precision that actually saves a mother in labor or a child with an infection today.
But the engineering approach is exactly what is failing us now, because biology refuses to act like a static machine. The WHO report explicitly highlights how biological and environmental realities are quickly outpacing our targeted medical coordination.
You're talking about the rising malaria numbers.
Exactly. Since 2015, global malaria incidence has actually increased by 8.5%. And why is that happening? Because climate change is warming new regions, expanding the geographic range where mosquitoes can survive.
Which is an ecological shift, yes.
And on top of that, those mosquitoes are developing resistance to the targeted chemical insecticides we rely on. You just cannot engineer a permanent medical solution to a shifting ecological reality.
Right, and the malaria parasite itself is mutating to evade rapid diagnostic tests in certain regions, which complicates the clinical side even further.
Yeah, right. And it's not just malaria. The report issues a dire warning about antimicrobial resistance, or AMR. In some settings, nearly half of bloodstream infections caused by E. coli show resistance to our most critical, last-resort antibiotics.
And for our listeners, let's unpack how that actually works. Because AMR isn't just a random occurrence, it's an evolutionary bottleneck. When we flood an environment or a population with a specific antibiotic, we kill off all the susceptible bacteria.
Leaving the strong ones behind.
Exactly. The few bacteria that happen to have a random genetic mutation protecting them from that drug, they survive.
Precisely. We essentially clear the battlefield of their competition, leaving those superbugs to multiply and spread. It is a slow-motion wildfire that is rewriting the rules of modern medicine.
It's terrifying.
And our highly targeted interventions are creating the exact evolutionary pressures that pathogens are adapting to. We are hyper-focused on the chemical weapon while ignoring the broader environmental and agricultural context that allows these diseases to thrive in the first place.
Okay, I'll concede that evolutionary pressure is a massive challenge to the medical model. But let me give you a different perspective, using the report's own analogy. The WHO likens our fragile health systems to bridges suspended over turbulent rivers.
A very fitting image.
It is. And I agree with you that the river of climate change and antimicrobial resistance is rising and getting more turbulent. But if we abandon our targeted maintenance strategy, if we stop reinforcing the steel beams of vaccination programs, antibiotic stewardship, and disease-specific funding, doesn't that risk total structural collapse?
Well, I'm not saying we abandon the bridge.
But resources are finite. While we wait to build your ideal utopian paradigm that somehow fixes global warming, reshapes agriculture, ends poverty all at once, people still need to cross the river today. We cannot let the perfect be the enemy of the good. Yes, malaria is increasing, but the solution isn't to abandon the targeted model. The solution is to accelerate research into next-generation bed nets and novel vaccines within that model.
But maintaining a bridge that no longer reaches the other side is a staggering waste of resources.
It still reaches the other side for millions of people.
But I am not suggesting we stop treating patients. I am suggesting that defining health purely by the absence of a specific pathogen is a fatal miscalculation. We are treating the biological mechanism of death as the only thing that matters, mostly because it's the only thing we know how to measure.
Well, I would argue we aren't even measuring the biological mechanism effectively. You're assuming we have a perfect map of who is dying and why. But the WHO data shows we are flying almost completely blind. This is where the data blind spot becomes the central villain of the 2026 report.
Right, the missing nervous system of global health.
Exactly. Let's look at the sheer scale of this. In 2023, there were an estimated 60 million deaths globally. Of those, Only 21 million were reported with any cause of death information at all.
Wow.
And of that group, only a staggering 12 million had meaningful ICD-coded data.
Which is just a tiny fraction of total human mortality.
Right. And before we move on, let's clarify that term. When we say ICD-coded data, we're talking about the International Classification of Diseases. It's essentially the global barcode of health. It's the standardized system doctors use on death certificates so that local governments and the global system know exactly what killed a person.
It basically translates a human tragedy into a usable data point.
And without that barcode, to the global health system, that death basically didn't happen. Think of it like trying to run a modern global supply chain where 80% of the cash registers just don't record what was sold.
You're completely blind?
Exactly. If you don't know what is killing people, you're just guessing where to ship the lifeboats. Add to this the pandemic shadow. The WHO estimates there were 22.1 million excess deaths associated with COVID-19 between 2020 and 2023. That is roughly triple the officially reported total. We cannot solve crises we cannot statistically see.
No, I agree with that.
Right, so if a disease outbreak is not coded, it doesn't exist to the ministries of finance or the global donors. My point is, the targeted medical model hasn't failed, our tracking mechanism has failed.
Look, the data is undeniably poor. The lack of basic mortality reporting is a tragedy. I won't argue that. But that supply chain metaphor only works if you assume we are stocking the right inventory in the first place.
What do you mean?
Have you considered that even if we had perfect hospital mortality data, even if every single death had a pristine ICD barcode, we would still be completely blind to the structural inequalities actually driving the sickness?
How so? If we know exactly what disease is killing people in a specific region, we can direct the pharmaceutical resources to stop it.
Because ICD codes capture the final biological mechanism of death. They do not capture the structural violence that initiated the process. Let's look at women's health in the report. Anemia among women of reproductive age has actually increased slightly since 2012.
Right? A concerning trend.
Now, under your model, you code the anemia, you measure the iron deficiency, and you prescribe iron pills.
Which treats the anemia.
But it doesn't fix the cause. Anemia isn't just a lack of iron in the blood. In many parts of the world, it is a symptom of a lack of leverage in the household. The data barcode won't capture the gender norms that dictate women eat last and least. It won't capture the lack of economic opportunity.
That's a fair point.
And the report also notes that nearly 1 in 4 ever partnered women globally has experienced intimate partner violence. Perfect mortality data will just record the physical trauma or the resulting mental health crisis. We are obsessed with coding the symptoms, while the actual disease, inequality, remains completely unmeasured by our medical frameworks.
I see the logic there, but it skips a fundamental step in global governance. You cannot address the abstract without first quantifying the concrete. The WHO explicitly states that without accurate mortality data, governments are effectively navigating health crises with fogged windshields.
Fogged windshields.
Right. Isn't cleaning the windshield by funding civil registration and vital statistics systems, ensuring every single birth and death is legally counted? Isn't that the mandatory first step? Before we can even attempt to map out the broader social architecture you're advocating for, we need a functional nervous system.
Sure.
Data is the currency that forces political action. You cannot mathematically prove where the highest burden of disease is localized without it.
I agree that we need the windshield cleaned. But what good is a clear windshield if you were driving the car off a cliff?
Meaning what, exactly?
Meaning that data might force political action, but the political action we are taking right now is to pull the plug on funding. The data is screaming that we are running out of money. Which brings us to the brutal reality underpinning this entire report.
The financial emergency.
Exactly. We are arguing over how to steer the vehicle, but the engine is dying. The report points out that as of 2024, 2.1 billion people still lack safely managed drinking water. Billions.
It's an immense infrastructure gap.
And this is proof that throwing money endlessly at reactive medical treatments is a bottomless pit. If a child drinks contaminated water, treating their diarrheal disease with targeted rehydration salts is absolutely necessary triage in the moment. But from a systems perspective, it is profoundly inefficient.
Because they'll just drink the water again.
Exactly. If we do not fund upstream solutions, water infrastructure, clean energy, housing, and sanitation, The healthcare system will simply become an increasingly expensive triage center for the failures of our environment. We have to stop funding just the hospitals and start funding the public health infrastructure that keeps people out of the hospitals in the first place.
Okay, I'll concede that shifting upstream to infrastructure makes sense in a vacuum. But biology doesn't care about our long-term infrastructure timelines. Let's look at the immediate threat the WHO is warning us about. The estimate is that official development assistance for health in 2025 will be 30% to 40% lower than in 2023.
Which is a massive drop.
Massive. Many of these countries are already facing high debt burdens and incredibly fragile economies. When you talk about funding clean energy and massive sanitation overhauls, you are talking about generational investments. But a 40% drop in development assistance right now causes an immediate, catastrophic shock to the system today.
But doesn't that shock just serve as evidence that relying on external donor assistance for essential day-to-day health functions is inherently unsustainable? We built a system dependent on charity, and now the charity is drying up.
It is evidence that when we pull funding, people die immediately. These aren't abstract budget cuts. A 40% drop means imminent vaccine shortages for children who will be exposed to measles next month. It means delayed tuberculosis detection programs. And critically, it means interrupted HIV treatments.
Which is a terrifying scenario.
It is. And we need to explain why. When a patient's antiretroviral therapy is interrupted because of a funding gap, it's not just a pause in treatment. It causes viral rebound.
Right.
The virus rapidly multiplies, the patient's immune system degrades, and crucially, the virus can mutate into a drug-resistant strain. It turns a managed chronic condition back into a lethal transmissible outbreak. When you cut the budget for the medical model, healthcare instantly becomes the paradoxical luxury you mentioned earlier.
Yeah.
We have a moral obligation to prevent the bridge from collapsing today. We cannot redirect critical, life-saving medical funding toward long-term sanitation projects while a child is currently waiting for an essential vaccine. The financial emergency demands that we restore funding to the targeted programs that have a proven, rapid return on investment in human lives.
It is a terrifying bind. I'll give you that. The threat of interrupted HIV treatment and viral rebound is a nightmare scenario, and I won't minimize it. But aren't we just holding the system hostage?
How so?
If we constantly say we can't afford to fix the plumbing because we have to spend all our money buying buckets for the leaks, we will be having this exact same conversation in 2030, and in 2040, and in 2050. The WHO report explicitly states that public health is built environmental stewardship and education, not just medicines.
True, but
If 99% of the world is breathing toxic air, and we just keep funding asthma inhalers and cardiac wards instead of transitioning to clean energy, we are capitulating to a broken system. The financial crisis shouldn't just be a panic mechanism to restore the status quo. It should be the catalyst that forces us to realize we literally cannot afford the reactive medical model anymore. It is too expensive to wait for people to get sick.
But remember what the SDGs were originally conceived to be. They were a political promise, a guarantee, that geography and birthright should not dictate survival. The WHO makes it clear that the last 20 years have seen unprecedented scientific achievement. We know the molecular structure of these diseases. We know how to suppress HIV.
We do.
We know how to prevent cervical cancer with the HPV vaccine. We know how to track disease if we invest in the digital infrastructure. The blueprint is there. It just requires the political will to fund it.
The blueprint is there for the science, yes, but the report also acts as a global mirror reflecting deep economic inequality and political hesitation. We have the scientific knowledge, but if 1.6 billion people are pushed to the brink of financial ruin just trying to access that science, the blueprint is fundamentally flawed in its economic and social design. Science that people cannot access without starving their families isn't public health. It's extortion.
Well, which brings us to how we synthesize these realities. As we look at the conclusions drawn from the World Health Statistics 2026 report, my position remains that we must accelerate the current framework. The narrowing window to 2030 demands that we restore the devastating 30 to 40% cuts to global health financing.
And fix the data?
Yes, we must fix the data nervous system by investing heavily in civil registration and mortality tracking, those ICD barcodes, so the invisible populations become visible to policymakers. And we must scale up the targeted medical interventions that have demonstrably pulled humanity forward over the last 2 decades. To abandon the proven medicalized model now, amid an acute funding crisis, would be a catastrophic unforced error.
And my conclusion is that the narrowing window to 2030 proves that incremental improvement of the current framework is a mathematical dead end. The world requires a total paradigm shift. We must stop treating global health as a series of isolated, pathogen-specific battles fought in clinics and hospitals. Health is an interconnected ecosystem.
Right.
If we do not integrate our health strategies with climate action, economic reform, water infrastructure, and gender equity, the pathogens and the environmental realities will simply outpace our medical technologies. The evolutionary bottlenecks will catch up to us. Healthcare cannot just be the commodity we buy when we are sick.
Though we approach the solution from vastly different angles, there is a clear convergence in our reading of a WHO's ultimate warning here. We both agree that the era of passive maintenance is over. Incremental improvement, just adding a few more rivets to the bridge, is no longer enough to rescue the promise of the SDGs.
Absolutely. We are in total agreement there. The report makes it undeniably clear that global health is no longer just a distant humanitarian charity issue. It is the foundational operating system of modern civilization.
Well said.
When a microscopic virus in one region can halt global economics, or air pollution in an industrial corridor can shorten millions of lives, healthcare ceases to be a reactive line item on a budget. It must be recognized as the core infrastructure upon which all resilient, functional societies are built.
For those of you joining us through the PBL Lab, this is where your work begins. We encourage you to dive into the WHO report's data yourselves. Look past the top-line numbers. Examine the invisible forces, the missing mortality data, the staggering out-of-pocket expenditures, the shifting climate indicators that are actively shaping our global health ledger.
The numbers are not just statistics, they are choices. Examine the mechanisms behind them closely, and ask yourself whether the interventions we prioritize actually address the root causes of human suffering.
We leave you with this to ponder. As we stare down the final years before the 2030 deadline, are we just desperately reinforcing a skyscraper built on a sinking swamp, or are we finally ready to inspect the foundation itself?
Thank you for listening.